This is part 2 of the Nonpharmacological Treatment Review for the PMHMP ANCC exam. Now we're going to talk about family therapies. Family system therapy concepts. A system is any unit structured on feedback, such as the family. The process by which all family members operate together is referred to as a family system. Family systems theory is based on the idea that one could not understand any family member part without understanding how all family members operate together in a system. The family system operates based on a set of rules that may be overt or covert. And boundaries are barriers that protect and enhance the functional integrity of families, individuals, and subsystems. System boundaries can be physical or psychological. Types of boundaries can be clearly defined boundaries, such as maintaining a person's separateness while emphasizing belongingness, or rigid or inflexible boundaries that may lead to distant relationships and to disengagement. There's also diffuse boundaries, which are blurred and indistinct boundaries that lead to enmeshment. Family system therapy concepts. There's circular causality, family homeostasis, morphogenesis, and morphostasis. Circular causality is an ongoing feedback loop, which is a series of actions and reactions that maintain a problem. Individuals and emotional problems are best understood within the context of relationships and through assessing interactions within the entire family. Family homeostasis is the tendency of families to resist change and to maintain a steady state. Morphogenesis is a family's tendency to adapt to change when changes are necessary. That's morphogenesis. Is a family's tendency to adapt to change when changes are necessary. And morphostasis is a family's tendency to remain stable in the midst of change. Family systems therapy was originated by Murray Bowen, who believed that a person's problematic behavior may serve a function or purpose for the family or be a symptom of dysfunctional patterns. The focus is on chronic anxiety within families. And the treatment goals are to increase the family's awareness of each member's function within the family and to increase levels of self-differentiation, which is the level at which one's sense of self-worth is not dependent on external relationships, circumstances, or occurrences. Triangles are dyads that form triads to decrease stress. The lower the level of family adaptation, the more likely a triangle will develop. Nuclear family emotional system. Level of differentiation of the parents are usually equal to the level of differentiation for the entire family. Multi-generational transmission process is dysfunction is present over several generations. Family systems therapy concepts continued. Family projection process is parents transmitting their own level of differentiation on the most susceptible child. Emotional cutoffs are attempting to break contact with the family of origin, emotional cutoffs, and sibling position influences interactions and personality characteristics. Structural family therapy originated by Salvador Minuchin, who played emphasis on how and when and to whom family members relate in order to understand and then change the family's structure. A person's symptoms are rooted in the context of family transaction patterns. The symptom is a function of the health of the whole family and is maintained by structural problems in the system. The main treatment goal is to produce a structural change in the family organization to more effectively manage problems, changing transactional patterns and family structure. Family structure is an invisible set of functional demands that organize the way members interact with each other. It's made up of subsystems, marital, parental, sibling, and there's coalitions. That's when two members join force against a third member, and boundaries. And all that is regarding family structure. Then there's structural mapping or genogram, mapping relationships using symbols to represent over-involvement, conflict, coalitions, and so forth. Hierarchies are distribution of power. Now we're moving on to experiential therapy. Experiential therapy was originated by Virginia Satir. Its experiential therapy is behavior is determined by personal experience and not by external reality. The focus is on being authentic, on freedom of choice, on human validation, and on experiencing the moment. Experiential therapy goals. Treatment goals are to develop authentic, nurturing communication and increase self-worth of each family member. The overall goal is growth rather than symptomatic reduction alone, and it does not focus on any particular technique. And now I'll talk about strategic therapy, originated by J. Haley. Symptoms are viewed as metaphors and reflect problems in the family structure. Symptoms are a way to communicate metaphorically within a family. The treatment goal is to help family members behave in ways that will not perpetuate the problem behavior. Strategic therapy interventions are problem-focused. Strategic therapy is more symptom-focused than structural therapy. Strategic family therapists are concerned mainly with those techniques that change the sequence of interactions, that are maintaining the problem. Techniques are straightforward directives, paradoxical directives, and reframing belief systems. Straightforward directives are tasks that are designed in expectation of the family member's compliance. Paradoxical directives is a negative task that is assigned when family members are resistant to change and the member is expected to be non-compliant. Use this technique with caution. Reframing belief systems is problematic behaviors are relabeled to have more positive meaning. For example, jealousy might be reframed to caring. Solution-focused therapy. Originated by Steve Desar, Bill Hanlon, and Inso Berg. The focus of solution-focused therapy is to rework for the present situation solutions that have worked previously. The treatment goal is effective resolution of problems through cognitive problem solving and the use of personal resources and strengths. Solution-focused therapy techniques. Miracle questions, exception-finding questions, and scaling questions. Miracle questions are, for example, if a miracle were to happen tonight while you were asleep and tomorrow morning you awoke to find that the problem no longer existed, what would be different? How would you know the miracle took place? And how would others know? Exception-finding questions, directing clients to a time in their lives when the problem did not exist, which helps them move towards solutions by assisting them in searching for any exceptions to the pattern. Was there a time when the problem did not occur? Scaling questions, on a scale from 1 to 10, with 10 being very anxious and depressed, how would you rate how you are feeling now? This is useful for highlighting small increments of change. Complementary and alternative therapies, CATs, deal with a connection between the mind and body and are viewed as holistic healthcare, which means dealing with the biopsychosocial and spiritual components of the person. These are complementary therapies that are used in addition to traditional medical practices. Alternative therapies are used in the place of medical practices. So complementary therapies are used in addition to traditional medical practices, and alternative therapies are used in place of traditional medical practices. Integrated therapies, recent term, used to describe the use of traditional complementary therapies. Why people use CATs. There's a desire for more control over decision making, decreased insurance coverage, preference for natural rather synthetic medications, increased costs of prescriptions, and failure of conventional medications. Mind-body interventions are guided imagery, medication, yoga, and biofeedback. Biologically based therapies are herbal products, vitamins, supplements, and aromatherapy. Manipulative and body-based therapies are acupressure, acupuncture, massage, and reflexology. Acupressure and acupuncture are based on the basic tenet of Chinese medicine that vital energy, qi or chai, I think it's qi, flows along specific pathways that have many points of access, and that manipulating these points by either hands or needles corrects imbalances by stimulating or removing blockages to energy flow. They are thought to produce effects by regulating the nervous system and aiding the activity of endorphins and immune system cells at different sites in the body. Also thought to alter brain chemistry by changing the release of neurohormones and neurotransmitters. Biofeedback is a process of providing a person with visual or auditory information about the autonomic physiologic response of his or her body, such as blood pressure, muscle tension, and brain wave activity. The person learns to consciously control these processes, which were previously regarded as involuntary. Biofeedback uses: stress-related symptoms such as anxiety, pain, insomnia, neuromuscular problems such as migraines, muscular tension headaches, Raynaud's, and urinary incontinence. There's also neurobehavioral disorders, enhancement of healing, and athletic and work performance. The desired outcome of biofeedback therapy is positive change in baseline measures, demonstrated skill at self-regulation, improvement in symptoms, improved use of skills of daily life, reduction of muscle bracing, and increased sense of self-efficacy. Aromatherapy is a therapeutic use of plants or oils to obtain many therapeutic effects such as analgesic, physiologic, and antimicrobial benefits. In psychiatry, olfactory stimulation used to elicit feelings or memories during psychotherapy. Herbal products and supplements is the practice of herbal medicine originated in China and is the oldest system of medicine. Herbal products and supplements rely on plants to cure illnesses and maintain health. Similar to prescription medications, many plants contain active compounds that produce physiologic effects. The FDA approval is not required, thus no uniform standards ensure quality, control, or potency. Omega-3 common supplements. Omega-3 fatty acids are used for attention deficit hyperactivity disorder, that's omega-3 fatty acids, dyslexia, cognitive impairment, dementia, cardiovascular disease, asthma, lupus, and rheumatoid arthritis. Another common supplement is SAMe, or SAMe, used for depression, osteoarthritis, and liver disease. It may cause hypomania, hyperactive muscle movements, and possible serotonin syndrome. So SAMe can cause serotonin syndrome. Tryptophan is used for depression, obesity, insomnia, headaches, and fibromyalgia. It's found in high concentrations in Turkey. Increased risk of serotonin syndrome with use of selective serotonin inhibitors, MAOIs, or St. John's wort. Vitamin E is used for enhancing the immune system and protecting the cells against free radicals. It's used for neurological disorders, diabetes, and premenstrual syndrome. It interacts with warfarin, increasing anticoagulant effect, antiplatelet drugs, and statins, increasing additive effects and the risk for rhabdo. Melatonin is used for insomnia, jet lag, shift work, and cancer. Sets timing of circadian rhythms and regulates seasonal responses. It interacts with aspirin, nonsteroidal anti-inflammatory drugs, beta blockers, that's the LOL drugs, corticosteroids, valerian, kava, and alcohol. And it can inhibit ovulation in large doses. Melatonin can inhibit ovulation in large doses. Fish oil is used for bipolar disorder, hypertension, lowering triglycerides, and decreasing blood clotting. It interacts with warfarin, aspirin, and NSAIDs, garlic, and ginkgo, and it may alter glucose regulation. Most herbals are contraindicated during pregnancy, and because they are secreted in breast milk, then also contraindicated during lactation. Common herbals with psychoactive effects include black cohosh that can cause menopausal symptoms, premenstrual syndrome, dysmenorrhea, Then there's belladonna that can cause anxiety, catnip can cause sedation, chamomile can cause sedation and anxiety, ginkgo can cause delirium, dementia, sexual dysfunction caused by SSRIs, ginseng can cause depression and fatigue, and valerian can cause sedation. Massage is believed to increase blood circulation, improve lymph flow, improve musculoskeletal tone, and have a relaxing effect on the mind. Meditation is consciously directing one's attention to alter one's state of consciousness, produces physiological effects such as decreased heart rate, decreased blood pressure and respiratory rate, and decreased anxiety, and increased alpha brain waves. Meditation causes increased alpha brain waves. Reflexology stimulates the body's natural healing power through massaging the feet and hands and ears. It alleviates tension by cleaning crystalline deposits under the skin that may interfere with the natural flow of the body's energy. It's based on the mapping of body parts on the soles and sides of the feet, hands, and ears. Treats disorders related to the represented body parts by application of pressure. It's used for back pain, migraines, infertility, sleep disorders, digestive disorders, and stress-related conditions. Macrobiotics are foods classified as yin, cold and wet, and yang, hot and dry. The goal is to keep the dietary yin and yang in balance in an attempt to live in harmony with nature. Yoga originated in Indian religious practices. It combines mind and body connection. It uses breathing, physical movements, and meditation. And this concludes the non-pharmacological treatment chapter review. The following chapter and video are chapter 9, and it's going to talk about depressive disorders and bipolar disorders.